My name's Joe. I'm a senior musculoskeletal physiotherapist working here at Imperial College Healthcare. So how do we diagnose back pain? Well, often, because we know it's a very common condition and usually it gets better alone with time, we don't need to look towards labelling it. However, if your back pain is stopping you from doing your normal day-to-day activities and it isn't getting better after a few weeks, it may be worthwhile trying to speak to a healthcare professional. If the pain is severe or getting worse, or you feel you're struggling to cope with the pain, this is also when it's important to try and talk to a healthcare professional. Often, people think that we need to use imaging, such as an MRI or an X-ray, to work out what's going on in the back. But an important point to note here is that your pain does not show up on an MRI or an X-ray. Sometimes people with back pain will have an MRI and this will show nothing worrying, but they'll still be in lots of pain. This shows that we don't need to have an MRI or an X-ray to work out if you have back pain. Often, the pain can be coming from the muscles or some of the ligaments, which won't show up on an MRI or an X-ray. Sometimes, if your healthcare professional is quite concerned about your symptoms, they may order an MRI or an X-ray to rule out anything worrying. Once a healthcare professional has asked you different questions, they will work out whether they need to do anything else. More often than not, using exercise and activity is the best way to deal with back pain. However, if they are worried about some of your symptoms, that's when they'll speak to other professionals to try and work out what needs to be done. There are lots of different treatments for back pain, depending on how severe or mild the symptoms are. For most people, anti-inflammatory medication, such as ibuprofen, can help settle the symptoms. Typically, if this is not a worrying condition and is a simple strain of the lower back or any part of the back, use of a hot towel or a hot bath can work really well to help impact the symptoms. It is really important to stay active and to keep moving and potentially do some exercise or some stretches to help alleviate the symptoms. Often, people can be tempted to sit in bed or to stay still throughout the day when they have back pain, but if you're able, it's really important to try and get yourself moving. If you're still struggling with your back pain and you've tried some of the simple exercises and techniques that I've mentioned, a GP or another doctor may look to try and give you an injection. However, this only tends to be when we've exhausted lots of other options or if the pain is really severe and not getting any better. Often, a physio like myself may look to set you up with some exercises and stretches or potentially book you into an exercise class with other people who have back pain. We may recommend you go and do some swimming, as the hot water and gentle movement can help the back. If you're having difficulty with the psychological impact of the back pain that has been going on for some time, your GP or doctor may look to get you in contact with someone who deals with cognitive behavioural therapy to try and talk you through how you deal with some of the symptoms. For long-term lower back pain that hasn't been getting any better and the symptoms are still severe, a GP or a doctor may suggest that you have an injection into your back or potentially a procedure that looks to try and block some of the nerves that can be contributing to your pain. Your back is in constant use every single day, and so it can be difficult to prevent back pain entirely. However, there are lots of different things you can do to help reduce the likelihood of you getting back pain. Often, this comes in the form of trying to stay active and completing lots of regular exercise. With the change in how we work, lots of people now are sat at their desk, either working in the office or at home. So, importantly, it's good to try and get up out of your chair and leave your desk to try and walk or get moving, as staying still in one position for long hours on end can increase the likelihood of you having some back difficulties. So, how do we live with back pain? For most people, back pain is short-lived and easily treated. For those living with longer-term back pain, it can be quite challenging, but that doesn't mean there isn't anything we can do about it. There are often local support groups, the help of a healthcare professional, and more often than not, people with back pain can go and live a full and active life. I hope you found this video useful.
you.